What's up, guys? It's Nicole, the Barbell Bombshell. We're here with Dr. Maggio of Peak Performance Sports Therapy. And I wanted to just briefly discuss disc injuries. And, it's so common. You see people all the time. We see people all the time. Injuries happen. We see people with these pre-existing disc injuries that come into us, to kind of rehab. And I guess what I'm looking to talk to you about is kind of order of operations. Like, what do you do after a disc injury? Like, is there hope for people? Do they have to stop doing everything?
So disc injuries are a really big issue, and we're seeing it a lot, especially just in society as we shift to like a very sedentary sitting posture, and then we try to undo 40, 50 hours a week of sitting with an hour or two a day if we're lucky of training.
Right.
But we're undoing all those motions. So it's an epidemic, what we're seeing with these disc injuries. It used to be in the literature, 20, 30 years ago, 1% to 2% of the population has a disc injury. Now it's like, I'm seeing, 16-year-olds and, people in their 20s with these horrible disc injuries that you don't think that they should have.
Yeah.
So the biggest issue is just, they always talk about the stages of grief or whatever. It's the same kind of thing for an injury. You gotta come to terms with the fact that you're injured, and letting your body know and just accepting it.
Yeah.
On back of my shirt it says being injured sucks, and it does suck. It keeps you from being able to do the things you want to do, but the ironic or tragic part of that is a lot of the things you did to try to stay healthy might have actually been causing the issue. So the biggest thing is just come to terms that you're injured and, attack it head on, and own it. Own your injury, but don't let your injury own you.
Right.
People, there's a lot of people out there that are martyrs and they want to be like, oh, I got this injury and I can't do this because I have this. And that's complete bullshit.
Yeah.
If you let that happen, then you're done. Once you're done mentally, it's done. The problem with disc injuries is the people that we think are the first line of defense to treat them, especially orthopedic doctors. They're the last person we should bring in, but we automatically default to that we got to go to them first, and that can have a lot of ramifications and problems down the road that you don't even want to have. So the first step is just come to terms with the fact that you're injured, and lay out all the facts. Look at what you're doing and don't be in denial about stuff. People like, how did this happen? You know how it happened. You're trying to deadlift 500 pounds when you don't have any strength to do that, but it looked cool when you did it. Or you don't take time to work on basic mechanics and get good at regular movement, but then you decide to put that in, your back blows out.
Right. And it may not be heavy, but rep after rep after rep, day after day, your tissues can only take so much in crappy positions, no matter how much load or not.
So I have a disc injury in my low back. I work with a lot of people. I've worked with, your husband. He had a pretty bad one too. And what it all starts with is it's a team effort. One thing that really upsets me is where I get patients that come in and they're injured, and as soon as they walk through my door, it's like all of a sudden they just dump their problem on me. Like, hey, I got this injury. Now you deal with it. And I want to, and they don't want to take any responsibility or help with it. They think that they can continue to do the same dumb things they did, and they're going to get better, which isn't going to happen. So I'm here as a source to help people, but I'm not the full-blown source. It's dealing with a disc injury is more mental than anything else. And the biggest thing you got to do in the beginning is, like I said, come to terms that you're injured. And the other one is you just have to rest. That's it. You've already beat the tissue up. You've already had a problem. You got to rest. But it's the different kind of rest that most people think. Like a lot of people think, okay, I got to go home and sit on my butt and just rest, which is actually one of the worst things you can do when you sit on your butt. When you sit, you actually cause a lot of compression in your lumbar disc. Actually loads the disc 300% more. So get up and stand. Your body wants to stand. And get out and just walk. Just walk and just be. My protocol for anyone that comes in with a disc injury that's acute is we got to get you out of inflammation. The only way to get you out of inflammation is to keep it from being loaded. So we're going to stop all activity that you're doing. I know you don't want to hear that, but we're thinking about your longevity long term. So if you decide that, I'm going to take a week off and you want me to give you a medal because you took a week off, it's not. This is a long process and we're in it for the long haul. but you got to be dedicated and able to do that.
Yeah.
So that's the first step, is you just got to quit unloading it. And the thing is too, if you're in your 20s or 30s or 40s or even a teenager, and if you're blowing out a disc, that's not normal. Your body's built to last for about 70 or 80 years. And if you're banging up a disc that early, you got something wrong with the way you're put together. And you just maybe got dealt a lousy hand. And you don't have as good a material as somebody else. Yeah. But that's what you have to deal with, and that's the cards you were, and you got to play them.
Yeah.
So you got to take time to just come to terms with it and unload it.
Yeah.
Once you can do that, then you got to get in there and clean up the imbalances that cause it. A healthy spine does not get a disc herniation without repeated loaded trauma, or if say you go out and get in a car accident and you get nailed from behind, then it will. But a disc can take a lot of abuse before it finally breaks. So the next thing is that disc broke for a reason, and usually it's because you have a ton of adhesion in those muscles from sitting all day long or overtraining or just overusing stuff. That adhesion causes decreased flexibility, pain, and weakness. So you need to get to a expert soft tissue specialist that can get in and break down that adhesion and get that out of there. What it's going to do is restore normal mechanics and function back to there. And the whole goal of the treatment is to take the pressure off of the disc, because your disc is just getting squeezed so tight because everything's not working correctly. So as you get that treatment and you're resting it, it can start to heal and start to get better.
Yeah.
But it's a long process.
Yeah.
You know,
it's possible.
It's possible.
But
it's possible, but you got to be patient and you got to be humble.
Right.
Humble and understand that you're injured. And you know what happens with other people too is, you know, they'll feel better after 2 or 3 weeks, and then they want to go right back into their old things.
Or even 2-3 months.
Yeah.
It could take a long time.
It takes a long time, but your only other option is surgery. And you know, the surgeons, they, you know, orthopedic surgeons are needed in some capacity.
Sure.
They're way overused nowadays because we just get in this quick fix society where we want to snip and cut and we'll be good to go.
Yeah.
That couldn't be any more wrong. And they'll sit there and they'll give you these BS timelines like, we'll have you back to up and moving in 6 to 8 weeks and you'll be back to normal functioning in 6 months. That's complete nonsense.
Yeah.
That is not true at all, because nothing that they're going to do is going to fix the dysfunctions that you have. So if you got a disc injury and you decide to get surgery, but you never fix what caused that in the first place, you're going to be back on that table again and having problems. Right. The issue when you do get surgery, recently in some of the diagnosis codes, they've actually come out with a code called failed back surgery, which is really scary.
Yeah.
So what happens is these people got all these surgeries and they do what's called a fusion, where they go in and clean out the bad disc and then they stick the 2 vertebrae together. Now they function as one when they should be 2.
So they're taking the one bad one out and
then sticking them together to keep them from moving too much.
Right.
Now what happens is the one above it and below it, they have to work harder to accomplish that motion. So you know where you're going to end up 5 or 6 years down the road? Back under the scalpel and having surgery again.
Right.
Which is great for the surgeon because now they get to treat you twice.
Yeah.
But not great for your back, and you're going to have a lot of problems with it. People were very short-sighted.
Right.
And the biggest thing I want people to know is, do not jump to surgery right away.
Yeah.
There's an order of operations to fixing any problem. The first thing is conservative care. And I'll be honest here, conservative care for me is not chiropractic and getting adjusted. It's not doing a bunch of stretches and exercises with physical therapy. It's definitely not cortisone injections and everything like that. Conservative care is, you have a mechanical problem that needs a mechanical fix. So if you're lucky enough, you have someone in your area that's a soft tissue specialist that can get in and clean up that adhesion. What it's going to do is allow you to not move on to the next step, because if conservative care fails, then you got to move on to a medical intervention, which is injections and pills and all that you don't want to. And then the last resort should be surgery. And unfortunately, sometimes there's cases where I have them, they come in the office and they're already so far gone, there's nothing we can do, and they have to get surgery, but it's not as much as you think. You just got to be patient with it.
So, you know, the first step with any injury, but especially with a disc, is inflammation, right?
Yep.
You have to have, like, you know, no inflammation, no pain, no acute pain. So after, you know, let's say, hopefully you're taking a couple weeks off, letting the inflammation get down, you're doing so by improving your diet, you know, getting good sleep, unloading the disc. So many people, like you mentioned, think, oh, I need to rest, my back hurts, I'm going to sit, and that's way worse. You need to be standing. Another common thing I hear is people want to stay active, and I get that, you know, for your mental clarity and your stress relief, that's fine. So they think, all right, I need to do low impact, I'm going to swim. What does swimming do for you when you
Oh my gosh, nothing irks me more than when someone gives this blind, you know, advice of, oh, you got a back injury, stretch and get in the pool. The pool is the last place you want to be when you have a disc injury. So just some basic idea about the spine. You have some muscles in the front called your hip flexors, and you got some muscles in the back called your erectors and your multifidus. What they do is they provide stability to your spine. So what happens is when you're walking around and moving, there's this huge force called gravity that acts on your spine, and it holds it in place and keeps it from moving too much. And those are what those muscles do. When you get in the pool, gravity goes out the window. And the other thing too is you start using muscles that aren't designed to do that. So you use your hip flexors to propel you when they're supposed to stabilize your spine. Your low back muscles start to tighten up and they can't stabilize your spine. So if you have a disc injury, stay the hell out of the pool. It's the worst place you can be. It's actually going to make your disc injury a lot worse.
Yeah, and I don't think I didn't know that, you know, until I asked you. I mean, I think, you know, okay, low impact, you don't want to be banging on your spine, so go swim for activity. But
and it's the worst thing you can do.
It's the tissues, it's the musculature.
The tissues hold everything in place. It's always a tissue issue until it's not, and that's when things blow up.
Okay, so inflammation goes down, we're unloading the disc. We get the soft tissue work to restore, you know, a healthy range.
Normal biomechanics and function.
Get all the, you know, the bad tissues out of there. So, you know, what's the next step? Do you think that, you know, slowly getting back into strengthening?
And there's a hierarchy of where you need to go. You do need to strengthen it, but it's not dynamic movements yet. So you get back to just body weight movements, air squats, lunges, planks.
But correctly.
Yeah, because now you don't have all those imbalances. You do that correctly. And then you ease into it. You don't just decide to go hardcore one day. And you want to see that you don't have any pain after you do that. So you have to, it's almost like you have to level up each time that you do that. And if that feels good and things are functioning and the tissue's staying clean, you're not having inflammation, you can ease back in. And then you can get into some barbell work. You can get into stuff like that. And you're going to find what your limit is. Your body is going to tell you, and then you need to respect that limit. And never go to that level unless you want to have some problems down the road. A disc injury can get better and it can improve, but it takes a hell of a commitment from you, and it also takes a hell of a treatment from an awesome doctor to get there. But you know what? It's still better than getting cut open any day of the week.
Yeah, I mean, it's a long-term investment. Like you said, you know, you're having this issue in your 20s, 30s, 40s, and, you know, think about how bad it's going to be 10, 20 years from now. You know, what is your life going to be? What are you going to be able to do? You know, are you going to be one of those people that bends down, I blew up my back again. It's like, well, bending down shouldn't be an issue. That's life. Yeah,
normal human, you know, we're basically the main job of our bodies is to propel us through space. And, the sad part and stuff when you look at literature and stuff like this, when like elderly people fall down and break their hips or they have an injury, they're dead in 9 months, because if you can't move, you die. Movement is life. And if you lose that, and the other thing I try to
or you get sent to a home, no one wants to take care of you.
I give people perspective too, like when a patient comes in, you're like, you only care about tomorrow. I care about how you're going to be when you're 70 or 80. And you need that perspective. And the other thing too is, the biggest caveat I give people is you need a doctor that's going to be honest to you and tell you what you want to hear. Not what you want to hear, tell you what you need to hear. There's plenty of doctors out there that'll tell you what you want to hear, and that sounds good, but at the end of the day, it's going to leave you in more pain and dysfunction down the road.
Okay, awesome. So disc injuries, it's possible to come back from. It may take a long time, a lot of help. Like you said, it's a team effort, a lot of things. You have to put your body in the right environment to heal.
And your mind too. You need to come to terms with the fact that you're injured and do whatever you can to treat it conservatively, because like I said, the other option just isn't what you want to do.
Awesome. Okay. Thank you. I will put a link in the bottom of the video to find an integrative diagnosis practitioner, because I mean, hands down, you guys.
There's not a lot of us. If you're lucky enough to have one in your area, you're really good. They're the best in the world. So and if you guys have any questions, feel free to contact us and we'll answer any questions. But the other thing too is, no matter what, always get a second, third, and fourth opinion before. If you have one doctor that wants to cut you open, you know, go and get another 5 or 6 opinions.
It's worth waiting another week to get a visit or whatever.